the ball. Get the ball.
At home in Isleworth, it's an exciting day for Michael and Anderson.
Come, get the ball. Get the ball. Get.
These doting fathers are hoping chihuahuas Oscar and Isabella will make them grandfathers.
We'd like to have little puppies. Because their characters are so strong, we would like to see their characters mesh into one little small puppy.
Just for you? No? Nothing? Shall I give it to Oscar? Oscar's the boy. He's always active and playing, running around, he run after dogs, playing with the ball.
He's mischievous.
Isabella's a little princess.
A real lady.
She's more delicate in everything she does. I cannot imagine a life without them.
No, me neither. We're totally in love with our dogs. Come on.
This afternoon, Michael's taking Isabella to the St. Margaret's Clinic to find out if they can make their dream become a reality.
And having small Oscars and Isabella would be kind of, great.
That would be the bonus, the cherry on the cake.
I'm a lady. I'm a princess.
Hello, mate.
Hey, Scott. How's things, all right?
Great to see you.
Yeah, you
Very
too.
good.
You too.
So let me show you a very special patient. This is Jimmy.
Scott's arrived at the Cherry Tree Veterinary Practice near Marlow. He's hoping specialist orthopaedic surgeon Michael Hamilton can do something to help Jimmy's badly damaged legs.
He was rescued from a place where he was basically kept in a crate his entire life.
Oh, no way.
And when they found him, he was absolutely covered in his own fecal matter to the point where they had to shear him like a sheep. And now he's got this very strange curved sort of spine and his knees feel terrible.
Two big swollen knees. Do they move much? Oh dear.
I know Michael very well. When he's looking at Jimmy, I can see that he is pretty shocked.
Crikey, this knee is just something else, isn't it? God, you can just feel it grating. That is not very nice at all. As you move those knees around, it's bone on bone, and it grates and it crunches, and it's just horrible. Oh, no, man.
You won't be impressed. Just see, he's real tucked up, isn't he?
Carrying that back left, isn't he? He's been very brave, isn't he? Both those knees, particularly the left side, they're toast. There's nothing you can do. There's going to be no cartilage in those knees. They don't move very much. They've got to be painful. Okay, so we'll just have to step outside, get x-rays.
The extent of the problem becomes even clearer on the x-rays.
Straight away, that does not look very nice at all.
It's terrible.
Sclerosis here, effusion here. So that is horrible. They would make it onto the rostrum of the worst knees ever, yes. Knee replacement would be the best option. If it goes well, that's the best option for the dog, no question. The other option, which we can do if a knee replacement didn't go right, the other salvage option is to just fuse it, get the dog out of discomfort.
You waking up? Good boy.
He's just the nicest dog, isn't he? And he's had a hell of a time by the sound of things. We can certainly help him out, and fusion, knee replacement, they're the options.
Michael, great to see you as always. Thanks so much for your
No
help
worries.
and advice.
Yeah,
and I
of
will
course.
pass all that on to Jill,
Yeah,
and
of course.
I'm sure she'll be in touch very soon.
Yeah, sure.
Okay.
Yeah.
Cheers. See ya.
At St. Margaret's, Michael's bringing Isabella in for a checkup with Joe and Emma.
Hello.
He's hoping his chihuahua will be given the go-ahead to have puppies.
Hi, got Bella for you.
Hi, Joe.
Oh, hello.
How are you?
Fine, how you doing?
Fine, thanks.
How's Isabella?
She's on heat at the moment.
So I see.
Isabella is sporting some fantastic pink party pants, shall we call them? A lady has to maintain her dignity, okay? So I'm all for the underwear.
Okay.
So definitely in season, no doubt about that.
Yes.
Okay, fine.
And I was thinking of, breeding her, and I'd like to know if this is the right time and get some advice and feedback.
Okay, so if Emma can help me out, we'll start at the top and we will work our way down. Her teeth are looking good, she's a really great weight, but I'm listening to her chest and I can hear there's a problem. Okay, so I can hear she's got a heart murmur. A heart murmur is an abnormal sound that we can hear. What I can pick up on the stethoscope is instead of just a lub-dub heart sound, there's a whoosh in between the two noises. So we hear lub-whoosh-dub.
I was shocked when she told me that. I always thought that Isabella was a little healthy little dog, and now I come here and I find out that she's got a little heart murmur.
Oh, I don't want Isabella to have a poorly heart. Okay. Yes, I know. Oh.
So that's something that I think we should look into before we think about breeding her, because we want to make sure that her heart can cope with having a pregnancy, and we want to also make sure that it's not something that she could pass on to her babies as well.
Isabella will now need to go to the practice's referral hospital, the Royal Veterinary College, for further tests.
I know Michael really wants to breed Isabella and have some puppies, but it really does rest on the ultrasound scan of the heart to see what's going on there. Oh, well, let's hope that everything's okay with the scan and that we can breed her.
Meanwhile, if you need someone to look after Isabella, I will be more than happy to do so.
She's my little baby.
We need to chat about you, don't we? As we thought, the changes are fairly severe. Both of his knees are exceptionally arthritic and abnormal after the years of neglect and cruelty that he's gone through.
Scott has brought rescue dog Jimmy back to Jill's sanctuary. After a series of x-rays, there is a lot to discuss.
The important thing with the joints is you should have a gap between the two bones, and he doesn't. His are wedged together tightly. It's rubbed away all the protective surfaces of those joints.
That's awful, isn't it?
And that's where the pain's coming from.
Jimmy's left back leg is the immediate priority. There are two options: a fusion of the joint, leaving the Border Collie with limited movement, or a custom-made knee replacement, which could cost up to £10,000.
Michael very generously has offered his services for free.
Wow.
So have you got some big penny jars that we can start shaking?
We'll do it.
Yeah.
I tell you we will. I never spend any money on myself. Everything goes on the animals. I've never been on an aeroplane. I don't possess a passport, so my life is here with the animals. Good.
Good boy. What do you think we can do to try and raise the money?
Well, at this moment, I'm not sure, but I know I will raise it. And if I don't, it'll have to go on the credit card.
Oh, really? She's so dedicated to the animals in her care. She's going to do the best of them no matter what. So even when she doesn't have the money, she's thinking she's going to throw it on a credit card. What a woman. Here, Jimmy, Mum's buying. I need a new pair of shoes.
I need some too.
Hey, brilliant. There we go. You and I shoe shopping. Poor Jimmy's leg.
Jimmy's leg comes first.
We agree on that one.
Yeah.
Calm down, Rico. I think he's getting stressed a bit now.
At the Richmond Practice, Leon and Agnes are hoping Scott can help 6-year-old Rico. Their miniature schnauzer can't be left alone without constantly barking and crying.
He gets very hyper, he starts panting, and it's just gets into that state that's, it's very dangerous for him as well. He's got a condition of epilepsy, and we just don't want to have that happen, that he falls down and has the fits when we are not there.
What kind of dog is he?
I mean, he's a lovely dog. He loves people. He's not aggressive at all. It's just his anxiety about, if someone leaves him at home alone, he doesn't like that. He gets very anxious, cries the whole time.
So can you tell me a little bit about little Rico's history?
Yeah, so basically he's a family dog. He was with my dad since he was a puppy for about 2.5 years, and then my dad unfortunately passed away. And then after my grandma couldn't look after him, he stayed with my brother.
Okay, and where was this?
In Poland.
Oh, wow.
We didn't want him to go to another home that he doesn't know, or go with other people he doesn't know, or end up somewhere which is not nice for him. So we decided we'll adopt him and bring him to the UK. We were thinking of flying him over, but we know his anxiety and it's going to be a lot stressful for him. So I decided we'd drive to pick him up.
Wow.
Yeah.
You drove to Poland to pick up a dog. Wow, that's dedication.
Yeah.
There's not many people that would drive 1,000 miles and back to pick up a dog, and they've done just that. So I know that Rico's in very, very safe hands. We just need to help them to get over this little behavioural glitch. Does he have any medical problems, any sort of medical concerns?
I know that my brother said he had epilepsy. So he had twice this year.
We've got a nervous dog who's now showing signs of seizures. And when a dog is nervous, their seizure threshold, the point where they have fits, is lowered. So he's more likely to have them. So it's very, very important that we get on top of his nervousness. A, so that he doesn't have any more seizures, and B, so that you guys get to have a life. Yeah. Rico doesn't know anything else but having 100% human interaction at all times. And sadly, when you are a working couple, you need to leave the house at some point, and that's where the problems are going to start. If it's okay with you, I think that we need to see this behaviour in action. So can I invite myself to your house?
Yeah,
Of
sure.
course, yeah.
Hey, Scotty says relax.
There we go. Look at Big Dog. Are you scared of the big dog, Isabella?
At the Royal Veterinary College, Michael's arrived with Isabella for her appointment with cardiologist Dr. Anne Kurosawa.
Isabella Betancourt. Hi, hello.
How are you?
Yeah, nice to meet you.
Today, he will find out if Isabella's heart murmur will prevent her from having puppies.
Do you want to come on into the back?
We were always dreaming of having a litter with them, and if the heart problem is going to be an issue, and it is going to be devastating for us. And we'll see you later, okay? Bye.
Good girl.
There we go.
Oh, good girl.
Her health is more important than anything else. She's our baby girl, you know, and we love her to bits.
Yeah, it's going to be a little cold. It's okay.
The scans soon show that breeding Isabella will be the least of Michael's worries.
It does look a little bit fused.
The doctors have discovered Isabella has a severe abnormality in one of her heart valves.
She can go into congestive heart failure, and in the worst case scenario, she may even experience sudden cardiac death. We did find some birth defects with her heart. Because her disease is severe, she is at risk of having collapse episodes. In worst case scenario, she may even die from this disease.
It was a really hard blow hearing this news from the vet today. I feel heartbroken.
Although there is no cure for Isabella's condition, there is a procedure which, if it works, would allow the blood to flow more easily around her heart by opening up the narrowed valve. It will be a difficult decision for Michael.
You never want to hear that one of your children is sick. Without her doing this next procedure, we might not have her for very long.
Back at Richmond, vet nurse Gemma is expecting some special guests.
So we've got a pug party today. It's great fun. We've got tea and cakes. There's lovely cupcakes for the owners and obviously doggy treats for the pugs. There are pugs everywhere and they're having a great time. It's madness.
It's an opportunity for proud owners to indulge in a little mutual appreciation.
Something about pugs, they have a good effect on people, I think.
Very exciting, isn't it?
I got my first one 15 years ago and I've been hooked ever since because they are real funny creatures. Pugs are chaos wherever you go.
But it's not all about tea and cupcakes.
And thank you so much for coming here today. I'm Rick Sanchez.
We are very lucky to be joined by Rick, who is a top ophthalmologist from the Royal Veterinary College.
As you know, I have a special interest in pugs and their eye problems.
They have a problem with their eyes that we call pigmentary keratitis or keratopathy,
where they develop a sheet of pigment over their eye, and it can potentially, in some cases, cause blindness. And so we're following a large group of pugs and see how prevalent the problem is in Britain.
Little is known about the cause of the condition, and Rick's hoping this research will help develop effective treatment.
So we'll be examining their eyes, and we'll be going into the examination room, and we'll go one by one. So if you're all ready, we can get started.
Me, pick me! This is the first time we're going to be meeting Rick. I'm quite excited. I've heard a lot about him. This is Tilly.
This is Tilly, and Tilly is how old?
15 months
15
now.
months, lovely.
First up is a test to measure Tilly's tear production.
Good girl. Good girl, Tilly. You're a good girl.
Not enough tears cause those cute bulging eyes to dry out, making them red and sore.
So that's fine.
So Tilly's my first pug that I haven't had any eye problems with yet.
Oh, that's amazing. How many pugs have you had?
She's my fourth pug now.
She's your fourth pug, wow.
So we're hoping that she continues.
Charlotte hopes Tilly won't go down the same path as her older pug.
Jasper had surgery about 2 years ago now, so it is something that we have to constantly monitor every 2 to 3 months with an ophthalmologist. He's on eye drops twice a day, every day for the rest of his life.
Now the all-important test for pigment in Tilly's eyes.
Yeah, no pigment on the cornea really is amazing. And that looks really good as well. Good girl. It looks really, really good. Mind you, Tilly's very young, and so that can change over time. So I always tell people, shine a light in their eyes over time, keep an eye on that, yeah, and talk to the vets about that.
Good girl, Tilly. Good girl.
Okay, who's next? Hey, Leon. Hey, Jay. Hi, Agnes.
Hello.
Wow, I can hear the boy is already kicking off.
Come in.
Thank you very much.
Come in.
Oh my goodness. He's very, very vocal, and I'm amazed that the neighbours aren't complaining.
Scott's arrival at Agnes and Leon's home has immediately brought Rico's anxiety issues to the surface.
Hello, champ. How you going?
But his frantic barking is all show.
Straight away, he greets me very, very positively. He's a really friendly, sweet dog, and he loves lots of cuddles. You're one affectionate little fellow, aren't you? Hey, you like a cuddle and a smooch, don't you? Well, it's very good to see that he's a very sociable and affectionate dog. Yeah. What I really need, though, is to see how he behaves when you're not here. And then we can just understand the problem a little more. To be able to see Rico behave normally, I need to do a bit of surveillance. Leon, you and I will go next door and we'll watch the footage. Agnes, you're going to be doing exactly what you do when you leave the house. So you're just going to be putting your shoes on, grabbing your keys, grabbing your bag, and then leaving. And then we're going to be watching little Rico and see how he behaves. Sound good?
Perfect. Excellent.
All right, let's get stuck in. This is a fantastic house because I actually get a live feed as to how the dog is behaving. Feels like we're in mission control. Yes. Should we grab a seat and settle in? We need some popcorn.
Yeah.
Interestingly, he's already looking at the door.
Yeah.
Just by her putting her shoes on.
Correct.
So he's relating the two already.
Okay. Wait. Rico, sit. Stay. Good boy.
Closing the door. It's quiet. For about 4 or 5 seconds.
Yes, that's it.
He really gets pretty stressed pretty quick, doesn't he? I mean, he's gone from just a little bit of whimpering to barking to howling. Yeah, I mean, he's really going for it.
We have a little bit of entropia, just grade 1. It's about 1/6 of the lower eyelid.
Back at the pug party, the serious scientific research is continuing into pug eye problems.
And then just brush border between 8 and 10, and she has some pigment growing into the cornea on this eye.
But while Rick still has plenty of examinations to complete in the consult room,
Figaro, where are you going?
outside the other major event of the day is now underway. The fancy dress competition. As a former fashion designer, Gemma's the obvious choice as judge.
So I have got the really difficult task of deciding who the winner is of the fancy dress costume. We have got a little monster with Hank, we've got Rastafarian. What's going to be wrong? We've got Goldilocks and 3 bears, we've got a biker chick, we've got it all going on. I don't know who I'm going to pick. You look awesome, Jess, don't you? I think the winner has to be the collaborative threesome, Goldilocks and the 3 bears.
Well done. Better than the England rugby team.
Yay!
But no one is going home empty-pawed.
Everybody gets a toothbrush tube for competing.
A perfect end to a perfect party.
So it's great to be able to come together and, I suppose, celebrate our pugginess.
Tea, cakes and pugs. Lovely.
Rico hates being left at home alone, and whenever his owners go out, the miniature schnauzer barks uncontrollably. Scott needs to come up with an answer. He's asked one owner, Agnes, to leave the apartment, while he and the other owner, Leon, continue their secret surveillance.
How long have you seen him actually bark for?
We've about an hour.
All he can think of when Agnes leaves the house is, I'm just going to scream until she comes back.
After observing Rico's reaction, Scott phones Agnes and asks her to come back.
Calm down, Rico.
One mistake she makes straight away is immediately giving Rico lots of attention. And that's understandable, that's human nature. If an animal's upset, you're going to want to try and make it feel better. But actually what she's doing is unwittingly reinforcing the barking. I bark, Mummy comes back and gives me a cuddle. Well, guys, I think it's pretty clear from today that he has a condition called separation anxiety. And the reason that he's developed that is purely and simply stress. I mean, he's lost his primary carer in your dad, and he's driven over 1,000 miles to come to the UK. And even though you guys are such dedicated, caring owners, it's still a new environment.
With the added complication of Rico's epilepsy, a solution needs to be found quickly.
There's 2 big words I'm going to throw at you, okay? So the first one is called counter-conditioning, and that's basically getting him to start thinking positively about something he thought about before as negative. So you leaving the house, that sucks. He hates it.
Yeah.
He does not want you to do that. So what we need to try and do is encourage him to think positively. So what you're going to be doing from now on is you're going to give him something to chew or something to play with just before you're about to leave. And so then he can start thinking positively, because normally, particularly as boys, we love it when we get food, and it's going to make us feel positive and feel happy. These are treat balls. Basically, you can pop his normal food in there.
Yeah.
And it rolls around. And then he's encouraged to look for his food. It's investigative. It makes him think about how he can get it out. So it's problem solving, using his brain. But also the food that you give him can be entertainment. And this is the way to make that happen. Then after him getting used to various treats and toys, then the next thing is something called desensitization. What you need to try and do is to actually ignore him for about 15 minutes before you leave and about 15 minutes after you arrive, so that you leaving the house and returning isn't exciting. It's actually really boring.
Yeah.
And boredom for dogs is actually an effective means of getting them to get over a behavior. Agnes and Leon have to earn a living. So if Rico continues to behave this way and they start getting neighbours complaining, who knows, the worst case scenario would be they'd have to rehome him. And I really, really hope that won't be the end of this story for them.
Bless her. It's going to be all okay.
2 weeks later at the RVC, tiny Isabella is being prepped for heart surgery.
Good girl.
Professor Virginia Luis Fuentes will be overseeing the procedure to open Isabella's fused valve.
If we don't do anything about it, there's a risk that she could suffer irregular heart rhythms, and those could be fatal. or in the longer term, she could be at risk of developing heart failure with fluid buildup in her abdomen.
After dropping Isabella off for her crucial procedure, owner Michael is finding it very hard to leave.
The notion that we might lose her is terrifying us.
Since Isabella's initial heart scan, Michael and his partner Anderson have suffered a tragic loss. Isabella's little mate Oscar was hit by a car.
It's been a rough 2 weeks for us. We both have taken the death of Oscar very badly. And with this pressure of Isabella going through this very painful procedure, it's been very tough, very tough. We are completely shattered. It's been hard for Isabella because she's been pining, because she's lost her lifetime mate. I honestly think that the comfort is that Oscar's a little guardian angel looking after her.
It's okay, good girl.
Hopefully she'll pull through and we'll have a good result at the end of the day.
All right, good girl, it's okay.
He's saying, hello, Jimmy, welcome.
It's also been 2 weeks since Jimmy was taken in by Jill at her rescue sanctuary in Berkshire.
You were such a good boy. Yes, this is fun.
For the first time in a life of neglect and cruelty, the 3-year-old border collie is finally surrounded by love.
It must seem to him very strange, the fact that people are being kind to him. I think he's becoming happier every day.
After being kept in a cage where he couldn't stand up, the bones in Jimmy's back legs now grind against each other, causing him chronic pain whenever he moves.
Jimmy's temperament is wonderful. He has never, ever growled or snapped, which is amazing. Good boy. Maybe he knows we're going to help him, I don't know, but he's a wonderful little dog.
Hi,
Jill.
Hi,
Scott.
How are you?
I'm fine, thank you. Aw.
Good to see you.
Yeah, come in, I've got you a cup of
Oh,
tea.
lovely, thank you.
Later that day, Scott arrives to take Jimmy for his major surgery. But first, he wants to reassure Jill.
Someone looks comfortable.
Yes. Yeah, I think he's made himself at home, don't you?
He really does. Who has got his paws under the table, hey? You have. Unbelievable.
Yes.
Over the past weeks, specialist Michael Hamilton has carried out extensive tests.
You see the little fibres there, what's left of a cruise ship.
Signs of long-term infection have been discovered, and it's now clear Jimmy's knees are so badly damaged that the knee replacement is simply too risky to perform. That's left a knee fusion as the only option.
Well, I think the procedure that Michael and you have decided to move forward with is a great one because it has far less complications.
Yeah.
So as much as it would have been wonderful to turn him into the bionic dog, what we need to do is turn him into a comfortable dog.
Yeah.
And this procedure is going to do that without breaking the bank and breaking you and meaning you can keep going on with your great work.
Yeah. And really, at the end of the day, all we want is for him to be pain-free. I think it's the right decision. Yeah. I have to be determined for my dogs because I'm the only one they've got.
Oh, you big pudding, hey? Say goodbye to Jill.
Oh.
Say goodbye. Hey?
Hi, Jimmy. Good
bye.
boy. Their life is in my hands, really. It is, but I wish I could do more. I do. You've got your chair back, Violet. Good girl. Good girl. Good girl.
Right, Jimmy.
The big day has arrived.
Yeah, all right, mate. So, plan is we're going to fuse his knee. The whole point is it's not going to be sore once we're done. That's the whole point.
Yeah, it gives some stability, takes away the pain.
Yeah, exactly. And he's going to be a happier dog.
At the Cherry Tree Veterinary Practice, specialist orthopaedic surgeon Michael Hamilton has started Jimmy's life-changing operation.
It looks horrible.
It's really bizarre.
Crikey, this is a very chronically inflamed knee.
He and Scott are immediately horrified by what they find.
I'd say of all the surgeries we've done together, mate, this is by far the most gruesome.
That's horrible, isn't it? Look at that.
Jimmy's knee looked like a bomb had gone off in it. It was horrendous. It was the worst knee I've ever seen. There was virtually nothing normal about it.
First, Michael will trim the ends off Jimmy's bones. Then he'll fuse them together and fix them in place with a metal plate.
When we actually made our cuts in the bone to kind of get flat surface on flat surface, those flat surfaces looked actually quite healthy. That looks pretty darn good to me. That's as straight as his leg's gonna go. And then what we do is we put our big plate from up here right the way down over the top down to here, and then we're done.
The plate goes on without a hitch, but Michael is not satisfied.
I was just a little bit unhappy with a single plate.
To keep it in that slightly flexed position and to support that fusion of the knee, Michael then decides that he's going to actually place a second plate over the central part.
There's a couple of here that's just a little bit awkward, but once I get them in, I think we'll be good.
But by doing so, we come up against a few problems.
Because I'm stacking these, they're not quite sitting perfectly on top of one another. As we are putting in the last screws on the second plate, I can't quite get them in because it's not perfectly aligned.
Michael's just throwing everything at it to try and get the best result.
I wasn't overjoyed about that.
Michael wasn't happy, and it meant for a very long procedure.
Sorry guys, I just kind of changed my mind a little bit.
At the RVC, little Isabella is about to undergo a risky operation to open up her narrowed heart valve. Dr. Rosie Payne will lead the team under the guidance of Professor Virginia Luis Fuentes.
My primary concerns during the procedure are going to be hypotension, arrhythmias, and bleeding.
There are no guarantees of success, especially with a dog as tiny as Isabella.
We always warn owners that we might do the procedure but not be able to help them as much as we'd like, but we're quietly optimistic that we should be able to make a difference. Okay, so are we okay to cut? Okay.
Today, a small tube will be put through Isabella's jugular vein, down into her heart.
So don't flatten the vein because it's not a very big vein. Let's see how that goes. God, there's no room for our fingers whatsoever. Okay.
A second catheter with a special balloon on the end will then be positioned across the narrowed valve.
Great, fantastic, super fantastic. When we've positioned it, we're going to inflate the balloon and hopefully take everything out, and her valve should be less obstructed. So if you could just screen and we'll see roughly where we are. Everybody covered? Yeah. Inflate the balloon. Okay, stop screening. It went, didn't it? Yeah. David, are you okay for us to go again? All right, screen please. That looks pretty good. Oh, nice. Lovely. Gorgeous. So it looks like we've managed to relieve the narrowing. Okay, lights up, please.
It will be a month before they know if the procedure has made a difference, but Virginia is optimistic.
Her size made it a little bit more tricky, but it looked like a good result in the end.
Isabella will spend the night recovering from the surgery before going home to her family tomorrow.
You got a really itchy nose, huh? Can you do a little scratch? Okay, look. I'll let you have your nose. You're awake now.
This knee joint isn't just inflamed, it's destroyed.
At the Cherry Tree Veterinary Practice, the hours are ticking by as surgeon Michael Hamilton strives for the perfect result for Jimmy's knee fusion.
Whether it's active or not, I mean, I think this dog has probably had an infection in this knee. I mean, look at that.
A long-time mate of this dedicated specialist, Scott knows Michael will never settle for second best.
Michael's a perfectionist, so he's not happy with just one plate. He needs this reinforcement plate.
Sorry guys, just a bit of a hitch in the home straight.
Michael fought and fought, but it just wasn't going on. So to then, after all that work and all those hours of surgery, to remove that second plate, that was fraught. It didn't go down very well. You want to get it absolutely right.
Yeah.
Even if it does drive you a little bit crazy.
Yes. So we took off the second plate, put the first one on really, really nicely, and put another little plate down the side. That was the right thing to do, and it should go nowhere. So I'm really happy with it. The thing that I'm very proud of is that I didn't just go, oh, it'll do, because it'll do sometimes doesn't do. That's not what I'm about. We want it to work. Perfectionist, possibly, yeah. Overkill, possibly, but I'll sleep a bit easier tonight, and hopefully Jimmy will as well.
So finally, even Michael is happy with his work. But the operation has run 2 hours over time, and the surgeon is running late for an important meeting.
My wife is going to kill me.
Yeah. Good boy.
But no one's going anywhere until X-rays confirm the surgery has been a success.
So that's a straight-on view of his ankle, that's a straight-on view of a hip joint, and that's a straight-on view of a knee. So I mean, that's a perfectly straight leg. It looks great. Really pleased with that.
Just call Jill soon. Hey, call Mummy. Tell her everything's gone well. A very long surgery, but that knee has been fused within an inch of its life, hasn't it? Yes, it has. This is the start of a good new life for you, eh?
Hello, Agnes. How are you?
Good, thank you. How are you?
Very good. My goodness, it's very quiet in here.
It's been 2 weeks since Scott's first visit to see the stressed-out Rico, and a lot has changed.
No barking. Goodness me, the change in you, hey? Are you being a good boy, hey?
So far, so good, but Scott needs to see what happens when the Schnauzer is left alone.
Rico's very calm and very relaxed in the house with us there, and that's fantastic. But I'm really intrigued to see the footage that Agnes and Leon have captured of Rico when they do leave the house.
So this is the bit we filmed this morning. So this is Agnes coming in.
So I'm just coming in, basically getting him occupied with some food as well, like you mentioned, with the little toys, so he can get occupied with his mind trying to get the food out. Good boy.
The food ball works exceptionally well to distract Rico from when his owners are going to leave the apartment, but also it tires him out. It makes him work for his food and also work out the way in which he can get the food out of the ball, which is tiring out his mind as well as his body. So it's a perfect tool for Rico.
So this is pretty much when we're kind of preparing ourselves to go to work. You know, the dog will still be in the room with us, and then we'll just give him a command just to sit and stay.
And basically just not interacting with him much so he can just get himself settled. It's difficult to stay away from him. He's a lovely, cute dog, and he wants your love, so you kind of automatically want to give him the love.
Good idea, nice and calm, getting prepared for that leave. So that's good, that's perfect, nice and calm, and close it. This is interesting.
And this is where I think the most improvement we've made, where, you know, he's in his bed, he's staying.
This is great. I mean, this is a calm, relaxed dog. You've left, he's like, I know they'll be back.
Rico, that is so good.
They've proved that old dogs can learn new tricks, and they've taught this dog that it's okay to be by yourself sometimes.
Good boy.
Here you go, good.
It's really good to see the training, the discipline, it actually works.
Good boy.
Hey, Isabella. Okay.
Good girl, take it.
Good girl.
Isabella's now back at home with Michael and Anderson after recovering from her heart surgery.
It's been a real tough time for all of us. You know, it's really been challenging, you know, with her surgery, Oscar dying, and it's been really challenging for everyone. You know, he meant the world to me, you know. I just can't explain.
The memory he left behind is really strong. You cannot forget it. But life is what it is. We just pray like he's in a good place. And he's going to be always part of our life, doesn't matter what happened.
It will be 3 weeks before Isabella's follow-up scan. But so far, all the signs are positive.
She recovered so quickly after the surgery. Sometimes it looks like she didn't even go through that big ordeal.
I think she arrived from the hospital. She was already jumping. She's much more alive. I think she's having more energy now than she had before.
I'm just happy it's all over and she's happy and healthy, and that's what's important to us at the moment.
I'm so glad she's doing better now, yeah?
Well, I think this is one contented pooch. What do you think?
Isn't it just? Yeah, amazing.
And Scott has dropped in on Jill to check on Jimmy's progress.
He's so much happier in himself. It's just incredible that we've been able to do this for him. Come on, let's see how you're going. Good boy.
The surgery is a success. Yes, it's a salvage procedure. He has a knee that's now fused, but the pain is gone. And that was the whole point of this, to give him a nice pain-free life and allow him to enjoy himself for the first time in his life. What's his future hold?
Well, we have a wonderful home lined up for him. She's a wonderful person. She's very patient and caring and...
Everything Jimmy deserves.
Yeah, yeah.
He's going to be adored for the rest of his life, and I know that's absolutely what he deserves. It's been such a great journey, and a great journey with you as well.
Yeah.
Until the next time we've got another sad case we have to fix, eh? And then the dream team will be back together again.
Yeah,
eh?
I hope so.
Cheers.
Cheers.
Cheers. Cheers, Jimmy.